what we are going to do is I'm just going to briefly introduce you to the problems that as a neurosurgeon that we face in treating the brain tumors, and then highlight what is it that we are going to achieve by newer technologies. So as all of you know that brain is enclosed in the skull and it is not visible to us. So what is it over the years has happened is that there are advances in the imaging. As you all are aware that the CT scans and MRI scans have come. With these imaging systems, we are able to now diagnose various tumors and other malformations in the brain at a very early stage. But what has left to the surgeon is that you are alright, you are diagnosing the problems what the patients have got, but how to manage them which causing the least problems, to additional problems to the patients, at the same time cure the patients by surgical interventions. So these are some of the pictures which I show here. That this is the MRI scan which showing the small lesion in the brain. So lesion in the brain, and then we have the features which suggest that these are the images which show that there is some functional areas of the brain. So you can know which part of the brain is functioning in what way. And the other one is this one. Other one at the bottom is showing how the nerve tracts, how the nerve fibers are going. That colored pictures are the ones which show how the nerve fibers are moving from the brain to the rest of the part of the brain. So these are the information that we can get as of today by doing the MR scan and other things. So these are the things, information which we have to take care at the time of surgery, so that these areas are not damaged while operating. So what are the challenges that we are facing is, you have to plan a surgery as minimal as possible so that the large areas of the brain is not exposed. Then we have to approach the lesions to a safe path. So there is no part of the brain which you say it is unsafe. But there are certain areas of the brain where you can really go through without causing much additional problem to the patient. So you have to identify those paths. And then also you have to evaluate the tumor resection. See, in brain what happens, the tumor is almost mingled with the brain tissue. So it's very difficult to distinguish between the brain and the tumor when the tumor is within the brain. So we should have some technology where you should be able to distinguish the normal brain from the tumor. And also you have to make the total resection of the tumor. There is no point just taking a small bit of the tumor and leaving the rest of the tumor there. You also have to do that. And then we have the other challenge is to visualize the structures around the tumor. It is not just the brain tissue. Around that there are a lot of nerves and the blood vessels. It is like if you damage a blood vessel, it is like cutting off a blood supply to that particular area, and the particular area of the brain dies. So these are the challenges that we face. So, and also we should be able to collect some deep-seated tumor biopsies without much making a large openings in the brain. These are the challenges that we face to minimize morbidity to the patients and then maximize the benefits to the patients. So the options available for the neurosurgeon is neuronavigation system. You can probably roughly translate into your present GPRS system. You know where you are, how you are going, like that. That is similar systems are there in neuronavigation system, where you can go and then direct your surgery to the particular spot. But problem with the neuronavigation is that you cannot do any scan within the operation theatre to know how much of tumor is removed, how much is left, and that possibility is not there. Other problem also is that once you take out the tumor or leave the fluid around the brain reduces in size. So your co-orientation, everything goes off. It is like you are driving in a car and you see that like Bangalore, one road is closed. You don't know. Unless you image the system again the Bangalore and see, yeah, this is the road you have to go. So that provision is not there in the neuronavigation system. Other systems that we have is the intraoperative imaging. In this, you can do a imaging like a CT or a MRI. There are facilities now available, but problem is you cannot navigate with them at the same time. So these are the two advantages and disadvantages with the systems that we are currently available. So ideal system should be for a neurosurgeon you should be able to do intraoperatively scans, so that what is the tumor, how much of tumor is there, and then also you should be able to navigate with real-time images, and also it should be less time consuming, And also there should be no limitation of the number of times you can do an imaging. For example, one of the imaging system available is an MRI, intraoperative MRI system. At least to do an MRI you need at least half an hour to 45 minutes each time you have to do. That is per time you want to do. Suppose you have to do 2 times, 3 times during the surgery, the duration of surgery increases so much. Also the additional cost that involved with that. And also it should be cost effective. So these are the ideal situations what we are looking for. So when you look for these things which matches most of these requirements, we have a new system called the Sonovan, which we are procured in this institution and which is going to be in operative use shortly today or tomorrow. What is the advantage of this Sonovan? As far as we are looking for imaging system, there are, as I told you, you have a system called MRI or a CT scan which can be done, but these are prohibitively expensive, and also you cannot repeat again and again. You can at best do once or twice during surgery, whereas this Sonovan system you can do any number of times because it just takes a minute or two to do the scan. So the Sonovan system is the most advanced 3D ultrasound. Most of the ultrasounds are 2D, like what you see the 3D movies and all. This ultrasound is the presently available advanced technology where you get a 3D image of the brain and the tumor. So it provides a highly accurate information about the tumor. What about the image guidance? This system is integrated with the image guidance system. So you can do a scan and then use your image guidance and see where you are and everything. So you don't use the previous old image, you use the image that is done at the time of surgery and then guide. As I told you, like GPRS, you take a picture of Bangalore at every minute and then guide yourself going through the roads. So like that it is the system that is there. So this image guidance helps the surgeon to do the radical resection, and also it is most preferred gadget because it combines both imaging as well as the guidance. It is less time consuming because it just takes about 30 seconds to do a scan and about a minute to do the guidance, that is neuronavigation. And then you can do any number of times because the time is very short for acquisition of the images. So you can do any number of times that you want to do during surgery. There is no limitation on the number of times that you can do the scan. It is cost effective because if you want to have a CT or MRI, the range of cost would be starting from 2 crores to 20 crores. There is a typing mistake. It is 2 crores to 20 crores. That is the cost involved that is involved in installing a intraoperative CT or MRI. Centers which have these facilities in India, at least 2 or 3, most of them in the Delhi and one in Bombay, it adds to the patient's cost management. At least about ₹1 lakh is added to the patient's cost when you use these systems for intraoperative use. So another problem that we encounter is the brain shifts. Well, that's what I was mentioning, that the brain shifts when you do the surgery. So this problem is eliminated by using this navigation system, Sonovan navigation system. These are some of the pictures which show that one on the side, that is the brain. I think this is not working. Yeah, that red lines are the ones which shows that the motor fibers, that is the brain fibers which are controlling the rest of the body. This is, and then the other one is where you are marking the flap on the skull of the patient. This is the next one. And the other one on the right, to your right, is the one which is done with the Sonovan, which delineates the tumors very clearly. That one. That is a tumor that you are seeing there. That is a tumor. This is what. So what we want to demonstrate is the imaging that you get is as clear as you get in MRI as well as what you get in the Sonovan imaging system. This is another example where there is a lesion in the brain on the surface here. This is the tumor that is seen on the sonogram image. When you add this one, further imaging, you can notice these are the bright yellow ones are the blood vessels which are seen around the tumor. So while you are operating with your navigation, you can avoid all damaging any of these vessels that are seen there and take out only the tumor, leaving the blood vessels intact. So this will prevent further complications for the patient and morbidity for the patient. This is another example of a tumor. This is the tumor seen in the ultrasonograph scan, and then when you do further scanning, you see that these yellow and violet ones are the blood vessels which are surrounding the tumor. So when you are seeing this, and this is the navigation probe, this blue line, that is the one which is just pointing to the tumor, so you can go there and rake out the tumor and preserve the blood vessels. This is one of the greatest advantage where you see both the tumor and the vessels together, and you can avoid damaging any of the vessels. And there are certain conditions called aneurysms which can cause subarachnoid hemorrhage. This is a case wherein this is the aneurysm which is seen